So the vibrating capsule is designed to mechanically gently agitate or oscillate or even better vibrate in the colon. So after a patient takes the capsule, it takes several hours for the capsule to reach the colon, which is the normal speed at which things go through the body. But when it reaches the colon, the capsule gets activated and then it gently vibrates inside the colon and excites the colonic muscle wall. And this excitation of the colonic muscle wall leads to gradual contractions of the colon, leading to peristalsis and stool evacuation. The clinical trial that we published recently found that when compared to the sham capsule, where they took an identical capsule but it did not vibrate inside the body and kind of gently dissolved in the body, the real capsule or the vibrating capsule had a 2 to 3-fold increase in the number of complete spontaneous bowel movements per week when compared to the patient's own baseline record of complete spontaneous bowel movements over a 2-week baseline stool diary. So the capsule was significantly more effective in improving stool frequency, the completeness of the bowel movement, and this was the major finding of the clinical trial study. In addition, they went ahead and defined 2 additional parameters. That is, instead of just increase of 1 complete spontaneous bowel movement, they looked at 2 or more or 3 or more. And even those higher bars were significantly more superior in the vibrating capsule arm compared to the sham capsule arm. So the efficacy data showed that the capsule was very efficacious and it was very safe and extremely well tolerated. So this is the first novel device or a capsule treatment for any GI problem today. So and for the first time we can target the treatment to the organ. Here in constipation the problem is in the colon. So we can deliver the capsule to the colon and activate the capsule in the colon where the problem is, rather than activating it in the small bowel or stomach or wherever it is. So that is a unique feature of this capsule. Likewise, we can change the parameters. Although currently we are restricted by the FDA to use the paradigm that they've approved for this clinical trial, in the future, based on clinical studies or based on research studies, if we find that there are other beneficial parameters which is more suited for a particular patient. In other words, for the first time, we can personalize this treatment modality based on the patient's clinical problem, based on their type of constipation. And that, I think, is for the first time we have this unique ability to do. Another thing is there are many other gut motility problems. For example, patients have what we call as gastroparesis, where the stomach is paralyzed. So in those individuals, we can start the capsule activation much earlier, maybe within an hour after they swallow the capsule, so that we can now stimulate the stomach and achieve improvement in stomach emptying. Likewise, there are patients with small intestinal bacterial overgrowth or small bowel dysmotility, and in that group, we can activate the capsule in the small bowel. So we have a unique ability now with this capsule device therapy that we can activate or target the capsule activation based on the underlying clinical problem, and that will lead to significant improvement in their clinical